Welcome to the continuation of a series of videos which are equivalent to a virtual clinic where we emphasize Down syndrome as a prototype of patients that display multiple dysmorphic signs. I would like to remind you that by now you should have seen several videos of patients with Down syndrome during the first year of life. If you have not, please do so now. The following videos concern patients during childhood and adulthood, and the scope and intensity of the visually recognizable signs and signals of Down syndrome change with age. So you should fully know and recognize the initial stages of these signs. So this third module then will present two patients, one child and one adult. The child will have the following signs, so focus your attention on them as you view the recording. So you're ready to go. Focus your attention on the signs just listed. Take your time, replay, stop, repeat whatever you need, and after you finish, we'll continue. So just a reminder, you should have seen these signs. If you have not, go back and re-examine the video. Next, we're going to show you an adult with Down syndrome. Here is the list of the signs you should focus when viewing the video. It is rather short, and we'll have a comment about that aspect. So go ahead and view this video. So why is it that this list is relatively short? Is it a reflection that these signs are harder to see among adults, or that we have less experience, or perhaps it is a reflection that the facial structures that call your attention in an infant had time to develop and sort of catch up in the adults? And a further complication factor is that many patients, and increasingly so, resort to plastic surgery to remove the stigmata of Down syndrome, for instance, the epicanthic folds. So in any case, we need to have a lot of more experience and exposure to patients with Down syndrome, and they're going to pose greater difficulties for you to recognize them among other patients with challenged or underdeveloped intellectual capacity. So thank you for watching the virtual clinic focused on Down syndrome within the context of the tutorial Dysmorphology A. You can view other modules dedicated to Down syndrome specifically. You can make a choice to continue now with the videos demonstrating dysmorphic signs of other syndromes, not Down syndrome, or you could make a detour and complete your exposure to Down syndrome further so that you will be an expert on the subject. And until next time, I wish you the best.